You have to play strong defense with your money. Hi, I'm Prof. Stacy, the money teacher, and welcome to my classroom.
Got no money on my mind, got no money on my mind, got no money on my mind.
This is the first in a series that will examine different types of insurance policies because you have to protect yourself, your stuff, your money, and your family. But let's start with the basics. Health insurance. You probably have it, but if you don't, you should. Insurance policies cost money, so usually I recommend that you decide if you need a policy based on your particular situation. Health insurance isn't like that. Unless you're Jeff Bezos, Bill Gates, or one of the other 1%ers, you should have health insurance. Even the healthiest person can get sick or injured tomorrow, and medical bills can break any budget. Medical bills are the leading cause of bankruptcy in the United States. So let me emphasize, you need health insurance. Now, if you're under 26, you can stay on your parents' health care plan, even if you're married with a kid of your own. In that case, just make sure that the insurance policy has an in-network providers near you, if you don't live in the same area. However, for the rest of us, most people get health insurance through work. If you work for yourself or your job doesn't offer health insurance, you can go to the online marketplace to find a plan. I'll link it below. But choosing a plan can be complicated. HSA, PPO, FSA, HDHP, the acronyms alone will send you to the hospital for a brain aneurysm. So let's dive into what they mean. There are three basic types of health insurance policies: an HMO, a PPO, and an HDHP. And then there's two associated savings plans, an HSA and an FSA. So we'll start with the first. An HMO, or a health maintenance organization, has a list of providers in every specialty, department, everything. Kaiser Permanente is an example of an HMO. You can go to any of their providers and they'll cover it. However, if you go out of network, they won't pay a penny unless it's an extreme emergency. This isn't necessarily a bad thing. Most people will be fine in their network. The only concern is if you have a complicated chronic condition and you need to see a specific doctor and that doctor's not in the network. On the good side, HMO monthly premiums, the amount that you have to pay to have insurance at all, are usually the lowest, and they also tend to have low deductibles. The next type of policy is a PPO, or a preferred provider organization. Think Blue Cross, Blue Shield, Cigna, one of those. For these plans, the insurance company has a list of in-network providers that you can go to, but if your favorite doctor isn't in their network, they'll still pay, just less than what they would have paid if you had used an in-network doctor. But you pay for that convenience because monthly premiums will be higher, and so will deductibles and copays. Last, we have the HDHP, or the high deductible health plan. These tend to operate like PPOs with an in-network coverage and an out-of-network coverage. However, the monthly premium is usually really low, but that deductible, that's going to be pretty high. These can be a really good option for healthy people who don't have a lot of medical expenses. But if you have a chronic condition, this plan may not be the cheapest one for you. Now, the medical savings accounts. There are two savings plans that the IRS will let you use to save money for medical expenses pre-tax. You can use these funds to pay out-of-pocket costs, your copays, deductibles, prescriptions, that sort of stuff. I'll link the full list of qualified expenses below. It's long, and it includes a lot of over-the-counter stuff too, so check it out. FSAs, or flexible spending accounts, are the most common. They're definitely handy, but be careful how much money you deposit in them because at the end of the year, you'll lose any unused money in the account. So, if you generally only have about $200 of out-of-pocket medical expenses, don't load it up with $1,000 just in case. HSAs, or health savings accounts, are less common, probably because you have to have an HDHP to qualify for an HSA. But a huge benefit of the HSA is that you can load it up, and if the money doesn't get used, it just rolls over to the next year. And you can roll it even into retirement. So how do you choose your plan? Well, again, most likely you're getting health insurance through work. So you find out what types of plans are available to you, what they cost each month, and what they cover. Then think about what your health looks like. Do you have a chronic condition? Consider a plan with a lower deductible. If you get injured sometimes, maybe you want a middle-of-the-road plan. If you're healthy, never sick, never injured, those HDHPs are probably looking really good to you. And then consider saving the deductible amount into your HSA. That way you have the deductible covered just in case something does happen to you. Oh, we're not done yet though. We have dental and vision add-ons. Most health plans don't include coverage for eye doctors or dentists in their plan. Instead, it's an add-on cost, usually around $10 or $20 for vision coverage and $20 to $50 a month for dental coverage. Should you get it? That's up for debate. I personally have vision issues and wear glasses. Paying $15 a month can pay off for me since the insurance reduces the cost of my eye exam and covers a new pair of glasses or contacts if I wanted. Out of pocket, those things cost an average of $531 per year according to VSP. So $180 in premiums, that's a win for me. However, I have family members who have no vision concerns, and they might not think that insurance is worth it, at least not right now. For dental care, it's a bit more important. The American Dental Association estimates that the average yearly out-of-pocket cost for dental care is $685. Let's say your dental insurance is $40 a month. That's $480 a year. You're already saving just on cleanings and an annual exam. But now you have a toothache and it turns out you need a root canal or an extraction, and that can get expensive really fast, and you would be glad if you had the insurance. Dental insurance also has another component to consider. People who have it are way more likely to actually go for their preventive care visits versus people who don't have it. And you really should go for your preventive care. An infection in your mouth can actually kill you if it goes unchecked. So that covers the basics of health insurance. How do you feel about your coverage? Is it actually doing the job you need it to do? Let me know in the comments and follow me so you won't miss the next video on the exciting topic of insurance.